Okay, so thank you very much. My name is Matt Birch. Once again, I am the host of these short discipline videos. I today have an opportunity to be talking with Lorna Lauder, who is the program lead for undergrad midwifery here in the School of Nursing Midwifery, Queens. I also have Hannah Garrity, who is a clinical midwife, and Charlene Spence, who's a second year undergraduate midwife here at the moment with us. And thank you so much for coming along to these sessions. What I'm really, really interested to understand, particularly with regards to midwifery, is what makes midwifery as a discipline unique when thinking about some of the other disciplines that we offer here in the school. And maybe Lauren, if you can answer that.
Yeah, I think the biggest thing about being a midwife in comparison to, say, nursing, for example, is that midwives are the only professional in the UK and globally whose sole focus is looking after women in the childbearing journey. So that might include seeing women before they become pregnant, and then continuing on through the pregnancy, right through to supporting women when they're giving birth, and then afterwards when they are with their baby and their family. And I suppose the other thing to say is that midwives don't just look after well women. Predominantly, most of the women that we care for go through childbirth and the pregnancy and afterwards without any complications. But sometimes complications do happen, and so midwives are skilled at being able to manage those and then work as a member of a team who are helping women to address whatever those concerns are. And I think a key part of that is about supporting the family as well as women, and also supporting her in that transition to parenthood. And we're very fortunate in the UK that we have professional midwifery. The term midwife is actually a term that is protected by law, so you can't call yourself a midwife if you're not one.
Right, very good.
And so it's a really important part of supporting the health of women, not just in that childbearing journey, but also the impact that midwifery has on the health of women for their whole lifespan. It's a really unique role, and we're very fortunate that we have that role protected and professional midwifery within the UK.
Very good. It's obviously a really pivotal role within that interdisciplinary team. And I guess what I'm really interested to understand then is, what does that actually look like on a day-to-day basis? You know, what is it that a midwife would tend to sort of do? And what do you think makes a really good midwife? I mean, Hannah, you've obviously experienced in a clinical setting. What would be your thoughts on that?
Well, I would mainly be based in delivery suite when I'm on shift in the hospital. So a day in delivery suite compared to a day in, an antenatal ward, postnatal ward may be very different in comparison. You could also be working in an antenatal clinic, you could be a community midwife, you could be a specialist midwife, so there's loads of different roles you can actually go into. But for myself, a day in delivery suite, that's kind of my niche. So you'd come on shift about 7:30 in the morning, you'd flurry through a mountain of scrubs to pick out your size and your discoloured scrubs, and they don't have to be matching, and you'd run up to handover with coffee in hand. The good thing about delivery suite is you get a handover, an individual handover of your patient if you do get a patient. So your patient is your one-to-one care in delivery suite, which is great. Some mornings you don't have a patient when you come on, and sometimes that can be quite nice. And if you don't, you do like check the trolleys or equipment, or just make sure the place is in good running order for the day. If I did have a patient, I would care for them until their care is stepped down as such. So it doesn't actually have to be women just having babies in delivery suite. I could have an antenatal patient, so like a woman who's pregnant, and they could just be in for extra monitoring. They might be a bit unwell. So if you're kind of fit that criteria, you would be in delivery suite. So I could be looking after her a whole day. I could also have maybe a postnatal patient who's a bit more higher risk. Maybe they could have like a cardiac condition. So again, I would just look after them until I could step down their care. But then obviously one of the main things that I would be in delivery suite for would be to help facilitate deliver babies.
Fantastic.
So that's one of the major perks there, yeah. And I'm mentioning all of that because some days I don't deliver babies. I mightn't deliver babies for weeks. I might not even deliver a baby for a month. Do you know, month? And I always think it's really funny. My mummy would still ring me and ask, "Well, any babies today?" And I go, "No."
But
Somewhat, yeah.
But to me, it sounds like a discipline, sounds like a career choice that has lots and lots of variety, in that
Yeah.
opportunity to be able to develop not just yourself, but your career pathway in so many different
Yeah.
ways. And I wonder just, so Charlene, obviously you're out there at the moment, you're doing placements. I wonder what your thoughts are around that in terms of day. And even what are you saying, what do you try and doing yourself when you're actually out there doing the work?
Yeah, definitely. I would say that something that I've learned, out in placements and what I've observed in other midwives is that you're an autonomous practitioner working as a midwife, but also what I really like is that midwives who know the value of team working as well, and know the benefits of getting, other health professionals involved, and the benefits for the woman, and the benefits for you as a midwife as well, because you learn from different teams. You learn from nurses, from physios, etc., dietitians, specialist nurses, and you all contribute. But I would say definitely a midwife who can, work autonomously, but also can value the team working as well.
Wonderful, fantastic. And again, you're obviously the most recent, I would assume, in terms of going through an application process to join us here in nursing midwifery. And I'm wondering, would you have any sort of suggestions or thoughts, or even maybe reflections on how you did it in terms of what people focus on through the application process to become a midwifery student?
Yeah. I would say really, really try and focus and remind yourself of why you specifically want to do midwifery. So for me, my background before I done midwifery, I worked in the ambulance service, and the reason why I wanted to transfer over to midwifery is like when you're in the ambulance service, like there were so many elements of it that I loved, but the element that I didn't love to it was like you didn't get to build relationships with any of the patients. It always just felt like you were always handing over the patient, whereas in midwifery, the element of midwifery that attracted me was that you were building the relationship with the women and with their families. So that was the element for me that made me want to say, yes, I want to be a midwife. So I would say really, really focus on the element that makes you say, I want to do midwifery because of this, and really, really focus on that, and carry that all the way throughout your interview. If I could give some kind of personal advice as well, is that me personally, whenever I'm doing interviews, I can really struggle with when you're looking around the room and you're looking at the other applicants. Sometimes I really struggle with self-doubt, and I just think, oh, that person's better than me, or that person's going to answer that question better than me. So if it could just give, like, just for me personally, like, I just try and blank everything out and just try and focus on you, and don't look at anyone else, because yeah, you'll be great and you've got this. So yeah.
Fantastic. And do you think that midwifery is for, we'll say, everybody? What I mean is it for a specific type of person, or do you think anybody, do you have experience to come and apply specifically for the role? What do you think in terms of that, Lorna?
Yeah, I mean, we have a really interesting mix of applicants, and that's actually what makes our profession really strong. We really welcome applicants from a really diverse background. So we have, applicants who are direct from school, and they bring a lot to the student cohort. We also have applicants who have maybe done a degree in the past, and this is a complete career change for them. Or we have applicants who've maybe always wanted to be a midwife, but have never just found the right time to do it. And so, we really value the diversity of our student cohort. We come from a really diverse spread, and there's a lot of sort of different ages, different backgrounds, different ethnicities. And we really want our student cohort to represent that diversity as well, so that the needs of women can be really fully met whenever we're caring for them. So I would say don't let, and I think what Charlene said was really important, that sort of element of self-doubt. We don't expect expect our applicants to product. We want our applicants to come with demonstrating and being able to demonstrate some passion and a real focus, as Charlene said, and almost like a rough diamond. Being on the programme actually really does help you to become much more polished as a person. You'll go through a lot of professional development on the programme, obviously, because you're on a professional programme of study. But I think those personal skills, we want to see something in you that is desirable, but we also do on the programme. So if you're able to show some passion and a real desire to want to be a midwife, we'll help you do the rest.
That's terrific. Okay, so if you're interested in that journey that's just been described and you want to join Lorna, Hannah and Charlene as part of the midwifery group that we just make sure to go through the process. All the information is obviously within our recruitment page. And if you have any additional questions, we have a frequently asked questions list on that page, but always remember that you can reach out and email us at any time as well. So I just wanted to say thank you so much again to Lorna, to Hannah and to Charlene. Really appreciate you taking your time and talking about the wonderful discipline that is midwifery.
Thanks, Matt.